talk today about good clinical practice. And one of the things that we find oftentimes, not only just as a trainer, but I'm an auditor as well, and you find that people's definition of what GCP is varies rather widely. If you're talking to clinicians, good clinical practice might be taking care of their patients, whereas if we talk with our regulatory folks, we're looking at other things as well. And of course, those in clinical, even in those that are working in the labs, when we talk about good clinical laboratory practice, we have a lot of different pieces that we need to bring into play. We're going to focus on some of the core components within the hierarchy of GCP. We'll talk about some of the changes that we have seen. And then we're going to talk to more, as we have outlined in these slides, information that might slip past us every now and then. When you look at the regulations, the bare minimum that we have to follow, as we know, for industry-sponsored research that's being submitted to the FDA for review and approval, and then we compare it to what we see in those warning letters, we know that we're struggling sometimes just to meet those bare requirements. So as we add more and more layers to that structure of good clinical practice, we need to be mindful of those things and make sure that we have integrated those policies and procedures and thought processes into our expectations for conducting clinical research.